Interstitial lung disease's symptoms. Patients with ILD can present with a number of symptoms. Most of the symptoms are nonspecific. Dyspnea, a sense of shortness of breath, is a common complaint of patients with cardiac or pulmonary disease. In most instances, the patient has attributed the insidious onset of breathlessness with exertion to aging, deconditioning, obesity, or a previous unresolved upper respiratory tract illness. Some patients deny the presence of dyspnea even when questioned. This usually occurs because they have limited their activity and therefore rarely experience any significant discomfort. Frequently, a spouse or friend brings the problem to the patient's attention. Cough. A dry cough is common and can be particularly bothersome in conditions that involve the airways, such as sarcoidosis, bronchiolitis obliterans with or without organizing pneumonia, respiratory bronchiolitis, pulmonary Langerhans cell histiocytosis, hypersensitivity pneumonitis, lipoid pneumonia, and lymphangitic carcinomatoses. A productive cough is unusual. For most ILDs, rarely, a mucoid, salty-tasting sputum is reported by patients with bronchoalveolar cell carcinoma. Hemoptysis, grossly bloody or blood-streaked sputum may occur in the diffuse alveolar hemorrhage syndromes, lymphangioliomyomatosis, tuberous sclerosis, pulmonary veno-occlusive disease, long-standing mitral valve disease, and granulomatous vasculitides. In some patients, diffuse alveolar bleeding may be present without hemoptysis. The clinical manifestations in such patients may be dyspnea and an iron deficiency anemia. The new onset of hemoptysis in a patient with known ILD suggests a complicating malignancy. Wheezing. Wheezing is an uncommon manifestation of ILD. It has been described in cases of lymphangitic carcinomatoses, chronic eosinophilic pneumonia, EGPA, and respiratory bronchiolitis. Chest pain. Chest pain is uncommon in most ILDs. However, pleuritic chest pain may occur in ILD associated with rheumatoid arthritis, systemic lupus erythematosus, mixed connective tissue disease, and some drug-induced disorders. In addition, the acute onset of pleuritic chest pain may indicate a pneumothorax. Substernal discomfort or pain is common in sarcoidosis. Extrapulmonary symptoms. Clinical findings suggestive of a connective tissue disease should be carefully recorded. These include musculoskeletal pain, weakness, fatigue, fever, joint pains or swelling, photosensitivity, Raynaud phenomenon, pleuritis, dry eyes, and dry mouth.